Nice. So, how's your weekend?
My weekend was fine, but we're not here to talk about my weekend.
Okay. Let's talk about my disease.
Let's talk about your diseases. Yeah. So we did a full evaluation.
Okay.
We did bone marrow biopsy,
Sure.
lab work, and basically we also did a PET scan, right?
Yes.
I didn't look at that. So you take a look at your PET scan. You been doing okay?
I do.
Very good. So your PET scan doesn't show any evidence of disease in the soft tissues, which is the most important thing. There's very small lytic bone lesions which will never disappear, and that's fine. But there's no activity, so that's excellent. So by PET CT, you're in complete remission. And by bone marrow biopsy, you're also in complete remission. And by chemical survey, you're also in complete remission.
Hallelujah.
Yeah.
Well, I got a lot of questions regarding the bone marrow biopsy results or final diagnosis.
Yes.
I want to
So
understand.
before you ask questions, I'm going to try to explain to you the definitions of complete remission we have. So in patients who have multiple myeloma and also in patients who have other types of cancers, we try to tell you basically with detail as much as we can
Okay.
what type of disease burden you have. So when you were initially diagnosed with multiple myeloma back in December of 2013, your bone marrow had 70% involvement with basically monoclonal plasma cells. At that time, your tumor burden was 10 to the 12 cells. We calculate that. 10 to the 12 means 10 followed by 12 zeros.
Okay.
So basically, quadrillion cells. Today, after you have received induction RVD therapy back in 13, transplant in 14 at Utah, and maintenance therapy first with lenalidomide and then with bortezomib, up until now, basically, in your bone marrow, there's only evidence of 0.1% cells that are monoclonal plasma cells by flow cytometry. So that basically is 1 in 10 to the 5.
Okay.
So you basically that's your level of minimal residual disease, only detected by flow cytometry. So that's basically around 10 to the 5th.
Okay.
So you've come down, 7 logs. 7
Okay.
logs, base 10. So that's where you are. This is considered also complete remission. The only word that we would use if you would have nothing here would be astringent complete remission. The other tests that we do is FISH for any chromosomal abnormalities, and that's negative. You don't have any evidence of disease there. they don't do next generation sequencing, but I could order it.
Please.
So we can do that. And all your chemical survey, your kappa lambda ratios are normal, absolutely normal, including in your bone marrow. The plasma cells that are seen by CD138 do not meet criteria, so actually in the bone marrow there is no evidence of plasma cells. Flow cytometry is the only way they detect monoclonal plasma cells, but the flow cytometry they use here doesn't meet the European standard flow cytometry for multiple myeloma. So this is even questionable. So I think you may be in a stringent complete remission even. So you're in top shape. So you've received basically all this therapy since 2013 up until now. It's been 8 years and you're still on maintenance. So
Yes.
one option is to stop maintenance and follow you every 3 months.
Hallelujah. I like
Another
it.
option is to continue the maintenance that you're receiving because you may still have something. But if you want to really fine tune, exactly where you are, I can get the next generation sequencing in the bone marrow sample and see if there's any evidence of disease. We are in Helena, Montana, so the flow cytometry that they have here may not meet the standard criteria for evaluation of minimal residual disease that we need in multiple myeloma. So I would take this with a grain of salt.
So are you going to send me to Utah to do that?
I'll send the bone marrow for next generation sequencing. Yeah.
So that means they're going to drill my back again?
No.
Is this for the blood sampling?
No, we will send basically the sample that we have.
You already had, okay.
Yeah, we will send that for next generation sequencing.
All right. How about the immunoglobulin A? It's kind of low.
Yeah.
It's not in the normal range.
Yeah.
Compared to
The other ones are normal.
immunoGNM.
Yeah, and that may be the result of the treatment.
Okay.
I'm not worried about that. Your prostate cancer, also, the PSA is 0.03, so very, very low.
So before it's like 0.01 and now it's 0.03.
Let's take a look.
Do you think later stage it will increase more or it will stay that way?
So the numbers that I have here from 2020 was in November of 2020, it was exactly the same number as it is today.
Okay.
0.03. Before, in October, it was 0.02. Well, that's not a significant difference. And before, in 19, it was 4.
Yeah.
And before, 1 month before, it was 6. So I think you were operated there. And then now it's been 0.03. So you're in complete remission. You don't meet criteria. You have to have to declare it progressive chemical progression.
Yeah.
You have to have 2 measurements that are significantly different upwards of your bottom, which is 0.02.
0.03.
Yep.
Okay.
So you're fine there. Other medical problems you have is the Barrett's esophagus, and for that you need periodic, EGDs, endoscopies that you can have per the gastroenterologist. I don't know how often they recommend you to have those upper endoscopies. And your hemoglobin A1C is normal, 6. So for someone who has adult onset diabetes, that's very good.
How about the history of anemia? It says in there, anemia, bone marrow biopsy requested. Do we need to follow up on that too.
Where are you reading?
I'm reading on the biopsy bone deep rock. It's right here. History.
Yeah, that's history that they put there. They put that there. That's wrong, actually. We requested the bone marrow not because of anemia. We requested the bone marrow for evaluation of multiple myeloma. So that's something that they put there. They, I don't know who.
Okay.
The clerics or the radiologists. Someone put that there, not me. We didn't order the bone marrow for evaluation of anemia. We ordered the bone marrow for staging multiple myeloma.
Okay. Next question. I know that they found the lymph nodes on the base of my
Yeah,
neck.
but they don't have any uptake. We all have lymph nodes everywhere.
So that is no significant
Yeah.
whatsoever.
Exactly.
So what is decreased bone marrow storage? Iron.
Basically, that's what it means, is your bone marrow basically has some decreased iron stores. And we see that.
That means I am anemic, right?
No, you can have decreased bone marrow iron without being anemic. You're a little bit anemic, but you also have been receiving treatment with Velcade, which will make you a little bit anemic.
Well, there is the ancillary studies, the chromosome analysis.
Mm-hmm.
Why is it pending? Are they going to pursue
The fish is normal. The fish is the chromosomal analysis, and that's normal.
Okay. So I noticed the megakaryocytes is adequate in number. This is the platelets.
Yep, that's
So-
the mother cells of the platelets. Mm-hmm.
Yeah, and multiple myeloma, my red blood cells are not in at different sizes. It's got a different form.
Mm-hmm.
So on these studies, do you think my red blood cells they are becoming more normal in shapes?
Yeah, I mean, I don't know exactly what you're asking, but if you're one of the ways to evaluate that would be to stay off of therapy and see how they evolve.
Oh, okay.
Because while you're on maintenance therapy, you're receiving therapy that will alter the growth of these cells. Now your hemoglobin is very good, 12.8, but it's not normal. Mm-hmm. For someone who has been treated, I mean, that's with bone marrow transplant and continues to be on maintenance therapy with Velcade, that's a very good hemoglobin. We wouldn't do anything about it. If you want to know more about your iron stores, we can get iron studies.
Would you mind doing that?
Yeah, we can do that.
Because so that I'm going to get out of that one medication that
Mm-hmm.
they're giving me. And also is this the Benz Jones thing about the urine protein? It says in here negative.
Yeah.
Okay.
Mm-hmm.
But when I go to the bathroom and lick, still, the water getting frothy. What does it mean?
Oh, that that can happen for many reasons. That's not a sign of anything.
Okay.
My urine is frothy too.
And how about my kidney function? My kidney is on top of the.
Yeah, your creatinine is normal, 1.19.
Okay. So how about if we are going to do uh, chemotherapy, do you think every 3 months will be adequate, or?
Yeah, if we stop the Velcade, so the first thing we're gonna do is send this for next generation sequencing to see if there's any trace elements of myeloma at the genetic level. If this is negative, then you can make a decision about stopping Velcade and observing every 3 months.
Okay.
Mhm.
So today is
If you want to get your Velcade today, you can get it. If with all this information you say, well, let's wait for the next generation sequencing, I don't want to take my Velcade, that's fine too. It's up to you.
and how about I'm taking dexamethasone before Velcade. Is there any way that will affect my system, because there is I read that if you stop the Velcade instantly, there will be effect on your system. Is that correct? On my own understanding?
I don't know exactly what you mean. The dexamethasone you're
Yeah,
receiving once a week.
Yeah.
We can stop it at any time, and the Velcade we can stop it at any time as well.
Okay.
You haven't been receiving dexamethasone daily. You've only
No.
been receiving it once a month.
Correct.
Yeah. we
Before the chemo.
can- and it messes up with your blood sugar. So
Yeah, that's the thing, and I don't want to, because when I take dexamethasone, even when I eat a little, my blood sugar
Sugar goes
is
up,
to
yeah.
the roof.
yeah, steroids have a lot of side effects. So these are the benefits of staying off of therapy. But if you want to do things more exactly, I think we can get the next generation sequencing and decide after that.
Okay, so let's wait for that results, and then when I come back and decides if I'm going to,
Continue
undergo,
or discontinue.
yeah,
Mhm.
not on a monthly basis, but with the
Yep.
like 3 months
3
interval
months.
will
Mhm.
be good.
Yep. So we're gonna do the Velcade and dexamethasone today then,
Uh,
or you want to wait for the results?
let's wait for the results.
Very
so
good.
that,
Okay. We'll do that.
All right.
Well, congratulations. Excellent results.
Are you going to sound the bell? Gling, 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 gling in there?
I'm not, but you can if you want.
I will.
Very good. But we don't have the results of the next generation sequencing yet.
Okay, let's wait for that, and
Yeah.
then before I ring the bell.
All right.
Well, thank you so much for your time, Dr. Preti, and
My
I really
pleasure.
appreciate
My pleasure.
your help and